First, I want to ask Mr. Bennett to chime in. Do you have any suggested strategies for increasing the number in the workforce, number of operators in the workforce needed to run these systems?
Chairman Padilla, yes, thank you very much for this question. I recommend like a three-pronged approach. The first is you have to have viable wages and benefits at a utility to attract the talent that's needed to operate these systems. And the only way to do that is to have financial viability for operations and maintenance, because that's where the salaries are supported to have the finances for the utility. So that's number one. The second is, and it's not just specific to Indian country, this is for the entire water industry in general, we have to have a top-down and a bottom-up approach of change. There's teams of people, or should be teams of people, working behind the scenes to make that happen. So we're talking about public service announcements, getting the general public, getting decision makers to understand that very important role of these men and women that operate the water systems. And then the third point goes back to the fundamentals, operator certification. We really need to take another look at the credentialing industry. It's kind of a mixed bag across the country of the way primacy agencies handle it, and there's lack of consistency. But we're seeing, unfortunately, at the Intertribal Council of Arizona, the operator certification program, the passing rates for the certification exams are dropping. The exams get more and more complex as the industry gets more complex. We're dealing with individuals entering into this work field that, some of them have college degrees, but most of them have just high school or GEDs. And you look at the Department of Labor competency model for water and wastewater operators. It's this pyramid with all these bricks of all these domains of knowledge. It's astonishing what they have to know, what's on the certification exams, and then the years of experience of putting into practice. We got to be careful with where the barriers are. We want folks to enter into this career field. And if there's too many barriers in place, which I think there are, maybe we should look at it again. And I think the Infrastructure Task Force is a great starting point of looking at that.
Thank you. Ms. Wallenbull referenced being on the verge of a partnership between tribes and other water agencies in Wyoming. I know there's both official and unofficial in California. Mr. Bennett, can you tell us why there are no federal guidelines for tribal wastewater operator certification?
Chairman Padilla, I couldn't tell you the reason why. I could tell you that it doesn't exist. I know that EPA is aware of the situation and that there needs to be some desire or will or impetus to create such a thing, like it exists in drinking water. For Indian country, we don't have such guidance. What that means is we don't have a way of classifying wastewater infrastructure. You begin with classifying the facility, and then the level determines what level of certification is needed. That doesn't exist right now. We don't have methodologies for operator certification for wastewater, and that needs to be created.
So, yes or no, would there be value in establishing that?
Absolutely is needed.
Okay, and is it an and or an or value added by reciprocity of certification between different states to help tribal systems?
Reciprocity is the process of equivalency from one jurisdiction to another. And so because tribal boundaries don't coincide with state boundaries, we do have operators where this is a very significant situation. Career mobility, we talk about operators leaving to take careers elsewhere, but the fundamental issue of reciprocity for tribal operators is who is the primacy agency for their facility and what regulations are applicable for their utility? And that is what there's a lot of, it's gray. It's hard to figure that out, especially when primacy agencies have varying degrees of regulations. And so figuring out what regulations are applicable to their utility and what type of training and certification is needed, that's where reciprocity comes in, and having clear distinction about the primacy agencies and regulations that are applicable to them. That's the issue.
Thank you. We spent time on the need to invest in operations and maintenance. We've talked about some of the workforce difficulties and challenges. I want to spend a few minutes talking about water quality. A statistic that many of us is focused on today is that Native American households are 19 times more likely than white households to lack indoor plumbing. It's so shocking, we made a poster. But the reality is that even this devastating statistic doesn't capture water quality, whether that indoor plumbing is actually delivering clean, safe drinking water and water for sanitation. Mr. Norton, your written testimony notes that health-based drinking water violation rates for tribal water facilities are higher than the rates for water systems regulated by states. Why is that? And what can we do to improve not only water access, but also water quality in tribal systems?
Thank you for the question, Senator Padilla. It comes down to having experienced and certified operators. And what we see in Indian country is the difficulty of maintaining these operators over time and the longevity. In our state counterparts, they have multiple operators that specialize in certain aspects of the drinking water facility and the wastewater facility. What we have in Indian country is an operator that wears multiple hats and has to do multiple tasks at multiple times. When this operator is down or has to do other personal business, the utility suffers, or the person leaves due to salary inequalities and the replacement. What we see in Indian country when we replace and the immediate need in addressing those health-based violations, tribes are forced to hire consultants at least 4 times, 3 times, or 4 times the cost, Senator. And it's another burden on the tribe that is unable to pay for the operation and maintenance. And they can't be passed on to the consumer. So, those are probably the main reasons why we start seeing health-based violations in Indian country. It has to do with the operation and maintenance of those facilities.
Thank you. Mr. Bennett, I see you're nodding quite a bit. Is there anything you'd like to add?
Chairman Padilla, yeah, definitely operations and maintenance is a major contributing factor. Most operators understands that it's all about protecting public health. It's number one priority on the mission of being a water and wastewater operator. The issue also is that these are designed to protect public health, but they're very complicated and take years to understand. And so things are not helped when the certification process does not measure operators' knowledge of the regulations. And it falls on local jurisdictions to measure that. And ITCA just got through the process of creating an assessment for tribal operators on the regulations that EPA implements on reservation lands. And the only way we could do it is to have the regulations at the fingertips of the operators on electronic tablets that they take out into the field. You can do a word search, and because if you were to print these things out, we tried, it's over 2,500 pages. But to have that as a tool for the operators is something that we just started this year, and we're hoping over time this will start to help.
Question for you. Is there something about the nature, the fundamental nature of the different types of water agencies that impacts, for better or for worse, access to safe, clean drinking water? And by the different types of agencies, I mean tribal versus other public versus private water systems.
Yeah, Chairman Padilla. Yeah, the 1,044 public water systems in Indian country, according to EPA's database, the majority are tribally owned, but there are significant numbers also that have different types of ownership. And we see differences according to the different types of ownership. For example, the casinos, they have a lot of resources, and so we see well-staffed, well-operated utilities. On the other side of things, we see these public-private public water systems at schools, whether they're tribally controlled schools or federally controlled schools. But a lot of these schools on these very geographically remote locations have their own water systems. And those are the ones that have very limited resources. They're typically, the operators are typically the custodial staff of the school, and they're handling the maintenance of the grounds and everything. And they have practically no budgets whatsoever. We see huge needs there. We see private enterprises in Indian country that have water systems, such as mobile home parks and that type of thing. And we do see very significant issues with some of those types of ownership public water systems.
Thank you. There's a few more issues I'd like to cover, but in the interest of time, we'll also offer questions for the record after the hearing and provide some time for you to respond. But the last issue I do want to raise for today has to do with water affordability, right? Different than access and quality, affordability. I mentioned earlier that in the first subcommittee hearing, we focused on the issue of water affordability and small water system assistance, because unlike other forms of infrastructure like bridges and roads, clean drinking water isn't primarily funded by taxes. Instead, more than 90% of the average utility's revenues comes directly from ratepayers. But unlike state and local governments who can also use tax revenue to supplement revenue from water bills, tribal governments don't have such a tax base and instead rely on essential government services like drinking water and wastewater for federal support. Mr. Bennett, your written testimony notes that over 90% of tribal public water systems are classified as small or very small systems serving 3,300 or fewer customers. So not a big customer base to spread capital costs across. This obviously presents challenges when structuring rates. How helpful would a permanent water rate assistance program be, whether it be LIWAP or an EPA program?
It's coming to me?
Yep.
Mr. Chairman, the need for some type of a subsidy to help bridge this gap where the scales of economy of the water utility model starts to fail, there needs to be some type of funding mechanism to help utilities bridge that chain, that difference there. The LIWAP program has been hugely successful, but focuses narrowly just on the one aspect of utility revenues, and that's the ratepayer. And so if you have a very small population, trying to figure out where that sweet spot is of setting the rates to cover all the costs. We do have technical assistance support out there to help utilities do that, but my suggestion is that there should be another funding mechanism to bridge that difference, to work hand in hand with LIWAP, but also primarily looking at the very technical side of things, not the economics so much side of things of the customer, but of what the community and the utility unique needs are. It is a very technical process of establishing rate structure, and there is definitely a need for an additional funding mechanism to assist small rural tribes with that.
Ms. Wallenpool and Mr. Norton, I'd like to hear a little bit about your experience or your utilities experience with LIWAP and whether you think Congress should fund a permanent water rate assistance program.
Chairman Padilla, yes. Actually, we received LIWAP funding for water assistance this year or last year. And I know it has been a big thing for our tribe. Our water billing currently is not in a great situation right now. Our water billing system is not enforced, so it's difficult to get everybody on the system. And, you know, even if we are a flat rate, but even if everybody was to pay, that wouldn't even sustain our system. It would just, you know, cover the operation barely. You know, wouldn't even supplement salaries or anything else. So, you know, the operation maintenance is continuously an issue, but the LIWAP actually did assist a lot of individuals. And, as you know, the funding goes back to the tribe, which helps with us too. So I think continuously providing that funding would be beneficial. And we also, because we are billing and we work with USDA Rural Development, they also have a program that assists with low income for water bills. So.
Thank you.
Thank
Mr.
you.
Norton?
The LILAP program was very successful for the Hoopa Valley Indian Reservation. It was based upon an annual income, and the majority of the annual income in Hoopa is below poverty level at 80%. Having the LILAP program continue is essential in our Native American communities. If we, as my colleague Mr. Brennan pointed out, if we can bridge that gap somehow where we can have the assistance of these to the ratepayer and then have the assistance from the Indian Health Service through their statute of O&M and helping offset those costs, it would be a mutually acceptable program that tribes would embrace.
Wonderful. Before concluding the